Welcome back, everybody. Infertility. It's frustrating. It can be emotionally painful. It can be life-changing, really, especially if there seems to be no explanation for it. But you're about to meet a specialist who says unexplained fertility is a myth, and that 95% of the cases that are out there today can probably be explained with a fairly simple evaluation. I want you to meet Dr. Peter Ahlering. He is with the Missouri Center of Reproductive Medicine. Doctor, nice to have you here this morning.
Thank you very much.
So 95%, really. That's going to be eye-opening.
It's a very high number, and we're always reluctant to say 100%, but it's very unusual that we can't find a reason for the fertility issues if you just look in the right places and do the proper evaluation quickly and effectively.
Not everybody's looking in the right places, because when you're in the throes of this, you do what people do these days. You jump online and you start Googling, and you realize, oh, I shouldn't have caffeine, and I shouldn't have alcohol. And perhaps, maybe there are times when the answer is that simple, but I have a feeling oftentimes...
Almost never. I mean, almost never, and one can get lost in the quagmire of the internet very, very quickly. But yet it is a useful resource in some circumstances, and people, I advocate, should use their resources. That includes friends, family, books, magazines, and things, but there's no replacement for speaking to a seasoned professional in the world of reproductive medicine, because things have changed dramatically, as you might imagine, in a short period of time.
Sure.
I mean, 5, 10 years ago, things were completely different, and theories and ideas were completely different. In how you approach the evaluation of the patient is critical, because you have to have a plan of action, or else you're going to spend a lot of time wasted, and that ends up in frustration among a lot of other difficult emotions. So,
let's talk about that evaluation, and you talk about a thorough assessment and really trying to figure out where the problem lies. What kind of time commitment is that to have one of these assessments?
Well, if you're able to get in from the beginning and before you go down the road of evaluation, which often can be misdirected if not done by the appropriate individuals, but if done appropriately from the beginning, a day. You know, most of the important information can be obtained from the patients with minimal expenditure of their time.
So what sort of treatment options are we talking about? Once we zero in on the cause, then what's the next step?
You know, obviously then you utilize the information that you get from the diagnostic evaluation and apply that to the individual couple and their circumstances into a treatment niche. And really there are very few treatment avenues out there for most patients. I mean, maybe 4 or 5 different things. And sometimes tincture of time and doing nothing, so to speak, is a legitimate option and a treatment per se. But you know, certainly things like in vitro fertilization are becoming much more common and accessible to the patients. You know, once out of the reach of many, now not so.
We often think about a lot of these treatment options as being pretty pricey and a heavy investment, but you guys have a unique approach when it comes to that as well.
You know, we do. We've developed and honed this over a period of 15 years now that we've been doing reproductive reproductive medicine, women's health. And it's utilizing the technology and applying it again to the individual so that you don't waste time and money, because wasted time is wasted money oftentimes. In finding the right treatment process as quickly as possible is just invaluable. It makes sense.
Don't wait is what it sounds like.
You can, yeah. It is easy to get information these days, but it's easy to, unfortunately, get misdirected.
Right. Offices in Tulsa, Oklahoma, and Columbia, Mo already, but soon something opening here on the home front. We're excited about that. So to schedule your free consultation and get more info, you can go to MissouriFertilityExperts.com. There's a number to call right there, too. It's area code 573-442-1886. Missouri Center of Reproductive Medicine, located on Keene Street in Columbia, Mo. But again, be on the lookout, Kenton, Virginia. Something opening around here sometime soon.
Very good.
Columbia's not that far to drive.
No,
so
it really
good
is.
help. So.
I go there every day, except today.
All right.